U.S. GDP may be declining at a slower pace, but the deficit as a percentage of GDP is rising, and that's got economists worried. Joining us now to discuss those concerns is Auerbauch, professor of economics and law at UC Berkeley. Professor, welcome to Bloomberg News.
Thank you.
What about these numbers gives you cause for concern?
Well, we can't keep doing this for much longer. During a recession, of course, we have to let things go, have a stimulus package, not worry so much about cutting the deficit because we have to make the economy our first priority. But this deficit is so big that it removes a lot of the maneuvering room we had in terms of waiting and taking things as they come in the future. We really have to act pretty soon after the recession's over.
Professor, give our audience a little historical context. What was this the deficit percentage to GDP back in the 1980s?
Well, it got as bad as around 6% during one year in the mid-1980s. During the Reagan administration, and of course we were very, very concerned about it then. That led to serious budget cutting both during the Reagan administration, during the first Bush administration, during the Clinton administration. We're now more than double that in the current recession, in this current fiscal year. That's going to be the highest deficit to GDP ratio we've had since World War II, and of course conditions were quite different.
Well, what does the White House have to do to slow the rate of growth?
Well, it's not just the White House. It's White House and Congress.
Right.
And what they have to do, unfortunately, it's not any secret in terms of the big picture. It's cut spending and perhaps raise taxes. Of course, the details are what matter, and we really don't know what they're planning to do, or for that matter, whether they have any plans.
And sir, you know, a lot of people don't want to hear that. You're suggesting it does have to be a combination of spending cuts and tax hikes, but there are some folks on Capitol Hill who say we're not going to raise taxes.
Fine, then they need to tell us what spending they're going to cut, because some combination of those two things has to happen, and it's not productive to say simply that no taxes can go up. If you're not going to raise taxes, you have to make all the necessary cuts on the spending side, and that means cutting a lot of programs that people like. And you can't have it both ways. If you want to have those programs, you've got to have higher taxes.
Professor, how does health care reform factor into this? If health care reform legislation is passed by Congress and signed into law by the president, what's that going to mean for the deficit?
Well, at present, it's not a good addition. They're going to spend a lot more money, and although people in Congress and the administration have hopes that they can, the term, I guess, is bend the curve.
Sure, they say they can do this without increasing spending.
Well, they'd like to think that they can, but the Congressional Budget Office has thrown cold water on that so far, indicating that what is in the bills moving through Congress thus far doesn't really produce much cost saving. So if you're simply expanding a spending program, even if it's paid for by taxes, you're making the problem worse because you're using the tax increase to pay for that expansion rather than to pay down the debt.
And you point out something that I found interesting. You say that you were reading a New York Times story, and that if we spend 16% on health care, then why isn't it fair to tax at 10% for health care?
Right. I mean, people have unrealistic expectations about what health care should cost them. We spend about 1/6 of our GDP now on health care, so it wouldn't be unreasonable for a family to expect to spend about 1/6 of its income on health care. And yet there's been a lot said about how that would be unfair to families. Families can't afford that. Well, as an economy, for the economy as a whole, we have to be able to afford that because that's what we're spending. So if some people pay less, then other people have to pay more.
Well, you say that there may have to be some rationing. Explain that.
Well, we ration now. We ration by having some people who don't have health insurance. We ration by making Medicaid payments sufficiently low that some providers won't accept Medicaid and turn people away. We ration through HMOs and other kinds of managed care where people can't necessarily get all of the procedures that they want right away. There has to be some vetting first. All healthcare systems have to have some sort of rationing because people aren't simply paying the market prices for the goods and services that they're receiving. In single-payer systems, like they have in the United Kingdom, it's quite explicit. In our system, it's less explicit, but as we go to greater and greater coverage and spend more and more on health care, we really do have to confront this reality.
Professor Alan Auerbach, he's a professor of economics and law at UC Berkeley, joining us live. Professor, thanks.
My pleasure.